Emotional Freedom Technique, EFT. Tap to relieve stress and burnout. This is an article in the National Library of Medicine from the National Institute of Health. The effects of the COVID-19 pandemic have exponentially increased stress, anxiety, and burnout levels for all healthcare professionals and students. The psychological effects of working with COVID-19 patients and the physical stress of working under distressing conditions exacerbate an already stressed workforce. Working long hours, shift work, short staffing, demanding workloads, dealing with death and dying, and conflicts with management, other staff and disciplines, and poor communications between disciplines are among the issues that can lead to burnout, anxiety, and depression. Emotional Freedom Technique, or EFT, is a holistic practice that's easy to learn and apply to self and produces relief from stress, anxiety, and the symptoms of burnout within minutes. There are many websites, videos, and tutorials which can teach and support the healthcare practitioner in the practice of EFT. The challenge of COVID-19 to healthcare professionals and students. Nursing, by its very nature, is a high-stress work environment. The work is often physically stressful and emotionally draining. Working long hours, shift work, short staffing, demanding workloads, dealing with death and dying, and conflicts with management, other staff and disciplines, and poor communication between disciplines are among the issues that can lead to burnout, anxiety, and depression. Burnout is a significant problem in the U.S. Reason that people leave their positions. Nursing students are not immune from these stressors, particularly during their clinical experiences. Some studies even report that student nurses experience higher levels of stress than students in other health-related disciplines. The effect of the COVID-19 pandemic has exponentially increased stress, anxiety, and burnout levels for all healthcare professionals and students. The psychological effects of working with COVID-19 patients and the physical stress of working under distressing conditions exacerbate an already stressed workforce. The scoping review revealed that the 230 healthcare respondents had psychological problems ranging from anxiety of various levels, stress disorders, depression, and anxiety. Nurses had higher rates of mental health effects than other healthcare providers. All these consequences were related to the risk factors of working long hours, having family issues, putting their health and family's health in jeopardy, minimal or lack of PPE, and providing frontline care to COVID-19 patients. In a global study of 44 countries during the pandemic, found that 10,051 healthcare workers, providers, physicians, and paramedical staff, that the stress levels of the respondents were 25.8% higher than the general population. This study noted that the increased stress levels among nurses leads to increased burnout and increased psychological distress, causing nurses to leave nursing. In another study on the impact of the pandemic on 1,200 nurses in the U.S., it was reported that 60% of acute care nurses experienced burnout, and another 75% are feeling highly stressed, frustrated, and exhausted. Younger nurses have been especially hard hit by stress, anxiety, and burnout. From the same U.S. study, 69% of nurses under age 25 report having burnout, which is twice that those older than age 25, which was 30%. Those younger nurses also indicated that they suffered a traumatic or distressing incident related to COVID-19. Of those nurses under age 35, 60% reported feeling anxious and 47% reported feeling depressed. The most significant issues that need to be dealt with are the systemic ones. Nurses feel that their facility institution does not support them. After 3 years of the pandemic, nurses are still reporting the same issues. Experiencing burnout, PTSD, and mental health challenges due to staffing shortages, working extended hours, being required to work mandatory overtime, and having unmanageable workloads. When healthcare workers experience burnout and other mental health challenges, patient safety is put at risk. Medical errors increase, hospital-acquired infections increase, and the general health of the healthcare provider is jeopardized. The costs of burnout are staggering. For those leaving the field are $9 billion for nurses and $2.6 to $6.3 billion for physicians. Other essential workers are not even included in these numbers. It is imperative that nurses and students find a quick, easy practice that provides relief from stress, anxiety, and the symptoms of burnout. Emotional freedom technique, EFT or tapping, is a holistic practice that's easy to apply and learn and produces relief within minutes. Number 2. Emotional freedom technique and the evidence. Emotional freedom technique is an evidence-based practice which is grounded in the integrative field of energy psychology. It integrates components of cognitive behavioral therapies, exposure therapy, and body stimulation of acupoints on the face and body. Because of EFT's acupressure component, it is commonly known as tapping. EFT begins with a simple statement of the issue of concern, called the setup statement. The format is, even though I have a problem, stress, anxiety, etc., I deeply and completely accept myself. The first part of the statement is the exposure piece. The cognitive piece is the self-acceptance part of the statement. As the statement is being said and repeated, tapping on acupressure points occurs. There are 8 acupressure points on the face and upper body that have an effect that specifically affects stress situations. There have been more than 100 peer-reviewed studies consisting of random controlled trials, systemic reviews, meta-analysis, and outcome reviews, signifying the efficacy of EFT for both psychological and physiological indications. EFT is easy to learn how to use and apply, non-pharmacological, no-cost, safe and effective in reducing stress, anxiety, and symptoms of burnout. An ever-increasing number of studies on the benefits of EFT for stress, anxiety, and burnout, as well as other conditions, are being documented. Many of these studies demonstrate that EFT is effective as a self-help tool and for use in healthcare settings by healthcare providers and students. These studies are evaluated according to the American Psychological Association's Division 12 Task Force for empirically validated treatments. Many studies have been conducted on the psychological effects of EFT. However, there's a dearth of studies on the physiological effects of EFT. A study conducted examined the effects of EFT on the brain and pain and other factors using resting rate functional magnetic resonance imaging, MRI, pre- and post-intervention. This study not only reported decreased levels of pain, but also somatic symptoms, depression, and anxiety. Also reported in this study is that EFT significantly increased happiness, quality of life, and satisfaction with life. These results substantiate the effects of EFT as a valid intervention. They also studied the effects of EFT on heart rate variability, heart coherence, blood pressure, and endocrine system by assessing cortical and immune system, by evaluating salivary immunoglobulin A. These factors were studied in conjunction with psychological symptoms. The outcomes of this study demonstrated substantial decreases in the physiological markers. as well as the decrease in psychological indicators, anxiety, depression, PTSD, pain, and cravings. There was a positive increase in happiness as well as in immune system. The findings of this study support the use of EFT to positive health and mental well-being effects.